Next, we'll have a panel of 3 differently affected patients with FSH, and I'm going to ask Dr. Matthews to introduce them.
And if you could each come up, Anne-Marie Richard, Don Lokerson, and Lori Heater. And these individuals have very kindly volunteered to do this, and they don't necessarily know what they're going to be asked. I think Dan Perez, I think he was the one who invited you guys to do this, wanted to get people who have had a range of experiences with FSHD. So what I'm going to ask each of you to do, first of all, is to just tell us briefly about how you came to have your diagnosis, what your diagnostic story was, and maybe what kind of FSHD you have. I'm going to start down there with me.
Hi, I'm Lori Heater, and I did not know in my childhood about what my fatigue was all about. I do not have this is not run in my family. And I, about age 30, started to be unable to raise my arms. I started asking questions and the doctors just told me I was getting old at age 30. And pretty much went to several different doctors, gave up, and then I started having my children. And my oldest son was diagnosed with hypotonia, low muscle tone, and the doctors that led us to with him actually looked at me and said, we need to give you to my fellow doctor, and that was a sports medicine doctor, and he knew exactly what I had. So about 7 years later, I finally got a diagnosis as to what was going on with me. And last year, or 2 years ago already, I participated in Dr. Twill's research for FSHD2, because when I took the original DNA test, it came out negative, and I got an official diagnosis 2 years ago of FSHD2.
Okay, thank you.
Hi, my name is Anne-Marie Richard, and my father and his sister both had FSHD. So I was raised knowing a little bit more about his symptoms and the way that he handled things, as well as his sister. Now, they were a year and a half apart. However, hers was very significant and his was moderate. I was told as a young child that I did not have it. This was pre-DNA testing, and in the days that they had tested us, all they did was measure the distance between our scapulas, and I was told at 7 or 8, no, you don't have this. However, as I was about 15 or 16, I started to notice some symptoms, inability to lift. I was in competitive judo, and I was having more and more difficulty competing because I was more fatigued than the other people that were my age. When I was about 19, we started to notice hearing loss, but my father blamed it on the 1970s rock and roll concerts, so I just accepted that for the longest time. When my daughters, I have 3 daughters, my twin daughters started to have some difficulties at 15 or 16. I realized that perhaps I also had FSHD but had not been officially diagnosed. I brought my daughters to be tested, and they're identical twins. They both have FSHD. However, in identical twins, you would expect that they would be at the same level, but that's not the case. One is much more significant. The other barely shows symptoms. But as we began to get them therapies and treatments that would help with the symptoms, we realized that we were going to cut to the chase and just have the DNA test, and they both tested positive. So as a nurse, I have gotten more and more involved trying to find answers for my own children, as well as, the FSH Society.
Thank you. Don?
Okay. I'm Don Lokerson, and I had FSH very early in my life, but we didn't know what it was and didn't do much about it. As a high school student, I was required to climb a rope to the top with my muscles, but they were too weak, and so I slid down the rope and blistered my hands. So that was one episode that I don't want to repeat. In college, I was required to salute for ROTC, but I couldn't get my arm up where I was supposed to get it, and I couldn't get in the ROTC because of that. And then physical showed one shoulder was higher than the other, but nothing was done about it because it wasn't really that much of a problem. Then I did a 50-mile hike with Girl Scouts, and going along the C&O Canal in 18 hours, I ate a sandwich every 10 miles, where the other hikers ate very little along the way, just because I was using so much energy just to get along the path. In 1984, I slipped on the ice and pulled my wife down on top of me. That wasn't too helpful. I kind of strained my arms on that. Then I went to an orthopedist who said that I was doing a study, they were doing a study at NIH, and asked me to call and get an appointment. And of course, of 3 days of testing, and a muscle biopsy was taken, and it confirmed that I had FSH muscular dystrophy. A new doctor, a podiatrist, ordered AFOs, which I'm still wearing to this day, still wearing to this day. And many years, these have been very helpful to get me around. They didn't need much adjustment either through the years. I was amazed how little necessary changes were made. For many years, FSH did not affect my life. In 1993, I hiked along the Alps with Girl Scouts, and helping make sure they all got where they were supposed to get. So anyway, that's my story about what I've gone through. Yeah, that's about all I have to talk about my life.
Thank you. So you sort of started this. I was going to ask if you could each tell us one or two things that you've learned or experienced about living with FSHD that has made life easier, that you wish you'd maybe started sooner, that you've learned, that you wished you'd known now, what you knew then, what you knew now, that kind of thing. So you mentioned, it sounds like the AFOs made a big difference for you.
Yes.
Can you think of, are there any other things that you would like to comment on that you...
Many people in my situation would get a stair climber for the stairs in the house and just sit on that and go up. But I keep on using my muscles to reinforce and help make my muscles do better in the house. I probably go up these stairs about every four times a day or so. So it depends on what's going on.
So you feel like staying active has been helpful to you,
For
walking
my
and
muscles.
hiking in
For
the
my muscles.
Alps.
For my muscles. The ROTC physical showed that I did have one shoulder higher than the other, by the way. So.
Let me ask the two of you, are there things that you have discovered, you've only recently knew you had the disease, but are there things that you have discovered in either with your family or for yourselves that you wish you'd known earlier or that you found to be particularly helpful for living with FSHD?
Well, in my case, my twins were born prematurely because of another syndrome. And they kept telling me the first few years of their life that they had cerebral palsy. So we were addressing things with cerebral palsy. I don't want to say that it didn't occur to me that they had FSHD. Even as a nurse, I was listening to the diagnostics of the doctors and the people that were surrounding us, some of the therapists. When I stopped listening and started observing more, spending more time watching all of the little things that they did, I was noticing similarities between my aunt and my daughter, Christina, and my father and my daughter, Mary Catherine. And it started to click. Maybe I needed to pursue this. But I brought them initially to an MDA clinic where a doctor had told my daughter that she was making it up, that she really didn't have any of these problems, that she was just overreacting she was running track and started to have difficulties keeping up. And it wasn't until I switched neurologists and really pushed the issue that they be DNA tested, to cut to the chase and stop chasing the wrong tail. I wish that I had gone earlier in hopes that maybe I would have had more information, but as we all know, it progresses at its own rate, and I don't think I could have really changed that anyway.
So you wish you'd sort of followed your concerns a little bit earlier?
Pardon me?
You wish you'd sort of followed your
I should have
suspicions
followed
a
my
little
own
bit
gut
earlier.
instinct. I find that over the years I've discovered that one of the personality traits of people with FSHD is that we're really determined. We have a resilience that doesn't always come with other disorders and diseases. So I feel that I should have probably gone with that a little more. Trust your own gut instinct. You know your body better than anybody else. And I'm saying that not only as an FSH patient, but also as a nurse. I see patients that come in that are hesitant about complaining or telling doctors what's actually going on with them. And I urge you to speak up more. Use that little bit of feist that you have deep inside of you that wants to let people know what's really going on.
Lori?
I guess I agree with you in many ways. I wish I had known earlier than I did. It was really hard in my family, being one that everyone's so hyper and go, go, go. And they were constantly telling me I was lazy and, the typical. And I was strange, but when I got my diagnosis, I actually was really happy. I was thrilled, and I'm like, yay, I finally have some answers I can bring to my family and say, this is why this happened, and this is why I'm doing this, and this is why I need to sit when you guys want me to keep going. And so, I in the past pushed myself, and I was in a great deal of pain all the time. And now I'm learned. I think the best thing I do is I have learned to listen to my body. And when my body tells me to sit down and stop, I do. And I don't push myself. But there is really a fine line of being, staying active but not overdoing it so that you lose something. You can't be sitting down all the time either. You need to somehow be, even if you're in a wheelchair, find some activity and get outside yourself too. I don't work anymore. I quit when my children were born, not even realizing I had this disease, but I've done tons of volunteering, and that mentally that has kept me doing really well with this disease. So.
The understanding this, I've had 2 patients recently who were yelled at or scolded by their parents and families because they refused to smile for family photographs. There's a lot of guilt on family members' part. Would any of you be willing to talk about how you explain FSHD to coworkers or people, in the family? You're going to provide 4-part harmony, but people who are more distantly related to you, how do you explain the facial expression, the tiredness? Do you want to start with Don again?
I didn't have much trouble with tiredness. I worked for NASA and was able to walk around quite a bit. So it was really not that big a problem for me when I was employed. And by the way, here's a picture of the 3 of us, triplets. We were the first triplets born in D.C., as far as we know. And so we became famous. And I do wear the orthotics, and that helps a lot for me to get around. I'm in the scooter right now just because we're going to have to go so much of a distance and go fairly promptly from one place to another. That's why I got a scooter to use for that.
How about you guys? How do you explain aspects of FSHD to coworkers and others in the world?
And, well, as a nurse, people would look at me and I would tell them that I had FSHD, and they would look at me and say, no, you don't. You walk. You're able to lift patients, and I would say to them, I had to find alternate ways to lift patients. I always had, and I would try to explain to them, I can't go in and just pick up a patient and move them like you do. I had to find alternate ways, use equipment to move patients from one place to another, and it was really tough for people to understand that I have a very mild case of it, but I do get tired. I do have hearing loss. I would have other nurses that would be very frustrated with the fact that I couldn't hear on the telephone. So I had to bring in special equipment for me to be able to take, phone calls from doctors and orders. And I was always extra cautious about writing things down just because I wasn't certain I was always hearing what I was supposed to hear. And they became a little resentful sometimes until I really sat them down and said, this is part of having FSH. In my case, it's the hearing, my inability to lift heavy objects. Like, I would have to have a nursing assistant come and carry, like, major equipment that had to be attached to my patient. I could do everything else, I just couldn't lift the equipment. Eventually, after showing them and explaining to them, finally, it started to occur to them, oh, okay. And some of them even said, well, why are you working as a nurse then? And I thought, well, why are you working as a nurse? I've always expressed to my coworkers, everybody does something very well, everybody does something not very well. I was able to put in IVs snap, and some of the other nurses were not. And I said, I have FSHD. I'm much better at this than you are. You had to laugh at the ridiculousness sometimes of the things that people would say to me. It was like, I don't understand how you can do this and this, but you can't do this. And I said, but, you can't do this, and I've been doing this for 20 years. How come you don't? And when you turn it around and show them a little humor in the fact that none of us are perfect. We'd all like to believe that there are parts of us that are perfect. However, none of us are perfect. We all have something that's not quite right, whether it's FSHD or some other inability. There's disabilities and there's inabilities, and I believe that everybody has abilities and inabilities. So if you verbalize that to people, I think they're a little bit more understanding.
Lori, any insights?
I think the most explaining I do is explaining that I have muscular dystrophy, not MS. Because many times I'll say what I have, and then I'll see that person a month later, and they'll go, oh, how is your MS doing? And that's probably the most with me. And also not understanding why sometimes I use a wheelchair or just a cane, or different situations. I can't walk long distances, but yes, I can walk around the church with a cane. They don't understand the difference.
So Don, you mentioned briefly starting to use the scooter for distances, and yet you're obviously very active. How did you? That's often a huge hurdle for people to face, is saying, okay, as Lori just mentioned, I need some help. How did you deal with that?
I felt that, first of all, in a big facility like this, the likelihood of me getting tripped and falling is pretty high because there's not much to hang on to. And so that's one reason I get the scooter for this particular meeting, for example. And I can only walk so far before my legs just tire out. And so whenever we have a long distance, we're going to have to walk without other transportation. Sometimes we get on these handicapped buses and get us in there, all right. But
how about when you very first used the scooter? Was it a hard decision? How did you decide when you very first started using it?
I use it infrequently. It's not been so regular, but so we judge the dynamics of what we're going to have to go through to get through whatever we're supposed to be doing, like in this meeting. So here it's kind of essential to have the possibility of going rather rapidly from one room to another and that sort of thing.
Lori, you said that you have a scooter that you use occasionally. How did you come to the decision to get one?
When my children were very small and I couldn't go do things with them, we decided to take my son on his 10th birthday to Disney, and just the thought of it was scary, There's no way I could get around, but I did get a wheelchair, brought that there, and it was fabulous getting around, with my kids, and they were little, and it's that experience made me realize that whenever I do need assistance, not fight against it, it just makes life more livable,
So I think our time is about up. Do any of the panelists have anything else that I didn't ask that you wanted to say?
Actually, there are a couple things. One is, I help with some fundraising for the Walk and Roll with Rich Holmes on the Cape, and we have said this to many people along the way. People will say to me, well, I really can't help a whole lot, If every person in this room were to approach 10 people, the money would be insane coming in. If you got $5 from each one of your 10 friends, you would be so far ahead of the game in helping. Every penny counts for research. I don't think some people realize that even the cost of different vials and simple slides and things that are used on a day-to-day basis. If you don't think that your dollar is going to count, think again, because every dollar really does matter in the research, and we're so close that I ask all of you in your own communities, in your own neighborhoods, in your own social groups, try to set some sort of small fundraiser up, because bringing that little bit in allows them to do one more project, one more exam, one more idea that they had started working on but didn't have enough funds to finish with. So if you can take that from yourself and offer that up, I think that would be a huge difference in getting to the cure. We're so close to finding out how things actually work and how different mechanisms are affected. And I think because we're so close, that this is a time that all of us can make a huge difference, no matter what your ability or inability is.
Thank you. Anything else? Okay. Thank you very much, and I'm sure there'll be a round of you of questions.